Hi, everyone. It's great to see you. Welcome to our webinar. I'm Dr. Charles Elder. I'm the Executive Director of MIU's brand new, groundbreaking clinical fellowship in Integrative Medicine and Ayurveda. The topic of tonight's webinar is diet, inflammation, and immunity. Three very important components of health. And as it turns out, they're all interrelated. And we'll be talking about that tonight. And we're going to talk about diet, inflammation, and immunity from both modern and traditional perspectives. And our intent is to give you a little bit of a taste for what the teaching program in our fellowship is going to be like. Our fellowship, which launches in August, is going to be the first integrative medicine fellowship, which has been provisionally approved by the American Board of Internal Medicine that has a special focus in Ayurvedic medicine. It's a 2-year distance learning program leading to a master's in an MS degree, and it will give you practical clinical skills, very practical, that you can implement in real time in your practice, even while you're taking the fellowship. In addition, you'll learn self-care tools that will help you to thrive and survive and do well in a busy clinical practice. And as mentioned, it is an ABOIM approved fellowship and the first of its kind. So what's really unique and dynamic about our fellowship, among many things, is the way that we are developing the curriculum to combine the general integrative medicine approach with the Ayurvedic approach to give a truly wholesome, practical, and integrative clinical tool set. And so the approach that we'll take to diet, inflammation, and immunity tonight is just that. First, we're going to talk about the general integrative medicine perspective. Then we're going to talk about the Ayurvedic perspective. And then we'll talk about some of the science supporting the Ayurvedic perspective. And then some questions and answers. So to get us started, it's a pleasure to introduce you to my colleague, Dr. R.T. Prasad, who is the director of our fellowship program.
Good evening, everyone. I'm Aarti Prasad. I'm a professor of medicine at University of Minnesota and also University of New Mexico. Today, I'm going to talk to you about anti-inflammatory diet, and I'm going to share my screen now. Can you see my slides now?
Perfect.
Okay, apologize for that. So we'll just go over the objectives again to discuss the causes and the role of inflammation in diet and health, and list some ways to measure inflammation in the body, and explore anti-inflammatory dietary components. So this is the slide that I was on when I thought the slide was being shown. So inflammation and why does it matter? Inflammation is a natural process of the body to respond to an external stimulus. And that stimulus can be in the form of an infection, a virus, a bacteria, or trauma to the body, or even toxins. And there is acute inflammation and chronic inflammation, as we know. So acute inflammation resolves after the damaging insult is gone or neutralized by the body. And chronic inflammation occurs when the insult actually persists or the response to the insult perpetuates in a different manner. And it can last for months or even years, such as we know in autoimmune diseases, such as rheumatoid arthritis. So inflammation is the body's response to injury, and it can upregulate immunoreactivity. So our immune system gets activated, and body starts to produce different kinds of inflammatory markers, such as cytokines, ferritin, and we measure some of them in the blood, like C-reactive protein or SED rate. And there's also microbiome in the bacteria. It can have a microbiological response to stress and inflammation. And there are also neural mechanisms which are involved in producing chronic inflammation in the body. And because of this chronic inflammation, there is presence of lymphocytes and macrophages, as well as there's new blood vessel formation at the site of inflammation. It can result in fibrosis and ultimately tissue destruction, and chronic diseases happen, such as chronic degenerative diseases. Some of the diseases which are linked to chronic inflammation that we know about, and more research is coming out on that, is cardiovascular disease, diabetes, obesity, Alzheimer's disease, autoimmune diseases such as inflammatory arthritis, and some gastropathies, and also cancers or neoplasms. So these are some of the clinical markers of inflammation that can be measured. So let's first talk about the erythrocyte sedimentation rate, called ESR. And it's a non-protein acute phase reactant. It actually reflects the plasma viscosity and the presence of acute phase proteins, which happen as a response to inflammation in the body. And an ESR more than 100 is frequently associated with an identifiable illness, such as infection, most common in tuberculosis or endocarditis, or when there is tissue injury or necrosis, such as acute myocardial infarction, surgery, burns, or acute or chronic inflammatory disorders, such as polymyalgia rheumatica, temporal arteritis, inflammatory bowel disease, gout, in which you will see very high levels of ESR. The second marker that is frequently measured is called the CRP, the C-reactive protein. And highly sensitive HSCRP is a measure through the lab when they can actually measure very low levels of CRP. So it's a sensitive, highly sensitive assay that they use to measure the low levels of CRP, which is a marker for inflammation. Now, CRP can be elevated in any condition also which is associated with tissue destruction or infection, inflammation, or neoplasm. And the name is derived from its ability to react with the C polysaccharide of Streptococcus pneumoniae. There are markedly elevated levels of CRP, which are most often seen in infectious causes. In other conditions where CRP is elevated is obesity, insulin resistance, pancreatitis, oral contraceptive use, interestingly, chronic fatigue, mild alcohol consumption, depression, increasing age, trauma, and some cancers. I'll talk specifically about CRP and cardiovascular diseases. And it definitely needs a special mention because it is considered by some researchers as a simple marker, others as a true risk factor for cardiovascular disease, and even as a measure to assess the effectiveness of a new therapeutic approach, which is targeting inflammation. So CRP can be used sequentially to see whether CRP is going down with an intervention or not. Typically, CRP is believed to have a very high negative predictive value. So if it's not present, that's a good thing. But if it's present, then it starts a whole series of investigatory process to see why it is elevated, especially in cardiovascular diseases. So the association of CRP and cardiovascular diseases, it varies, the risk varies by gender and by the diet quality. In 2020 study, which used the data from NHANES, the National Health and Nutrition Examination Survey, this is the NHANES survey is conducted every year. And in 2020 study, they pulled the data from the NHANES linked mortality cohort from 1999 to 2011 that included about 9,000 men and 10,000 women. And they did a median follow-up for 6 years, and they found that in men, there was a significant association between CRP and overall mortality risk, such that men with the highest CRP had a 6-fold increase in cardiovascular-related mortality compared to men with the lowest CRP, who had a 1-fold increase. So the P was significant, it was less than 0.001. In women, on the other hand, CRP was not associated with mortality risk. And in men, the association between CRP and mortality from cardiovascular disease varied by the diet quality. This finding really emphasizes the role of diet and its anti-inflammatory effect, and also serves as a reminder that CRP interpretation must take diet into account. So we do find in clinical practice, if you are in clinical practice, you know that we do elevated CRPs, and we cannot find a cause like why this person has high CRP. And this is just a reminder to us as integrative practitioners and clinicians that we need to start exploring dietary patterns with our patients. This particular slide shows omega-3s and omega-6s and how the metabolism of phospholipids happen in the body. So omega-6s are the inflammatory fatty acids, while omega-3s are the anti-inflammatory fatty acids. In the picture in the D, A, B, C, D, you see the D on the right-hand side, you can see that EPA is an essential fatty acid, anti-inflammatory. It actually competes with the cyclooxygenase, and lipooxygenase takes its place so that leukotrienes and prostaglandins are not produced. Instead, what is produced is seen on the green, which is called resolvins. What a wonderful name. It resolves the inflammation. So the names which are in green on this slide are the protective agents or non-inflammatory agents of the metabolism, and the effect of omega-3s over this phospholipid metabolism. The end products which are shown in red are the inflammatory factors or inflammatory cytokines. So the protective ones are protectins, myrsins, resolvins, and lipoxins. And the red ones, which I can't even pronounce the names for, they are too long and tongue twisters. They are the markers of inflammation. So just to summarize what was shown in the previous slide, that arachidonic acid is an omega-6 fatty acid, and it's a precursor to inflammatory prostaglandins and leukotrienes. So all those names which were shown in the red are the inflammatory prostaglandins. And EPA, and I showed you in the D picture in the previous slide, how it was blocking the lipooxygenase enzymes to produce the resolvin, which is anti-inflammatory. So the serum ratio of EPA and AA, arachidonic acid, is an indicator of chronic inflammation. So the lower EPA and AA ratio are associated. If it's lower, there is a higher risk of cardiovascular diseases, especially myocardial infarction, stroke, and cardiovascular death. And similarly, the lower quartile of EPA to AAA ratio in Japanese adults in observational study was associated with a 93% increased risk of cancer mortality compared to the higher ratio. And also EPA supplementation protected against cardiac hypertrophy and fibrosis in some of the studies published in 2020. So elevated arachidonic acid AA EPA ratio is associated with chronic inflammatory conditions. As mentioned before, there is an association also with depression. So they saw that 4.1 times increased odds ratio of depression in Japanese population with elevated AA ratio, AA to EPA ratio. And they were also seen in tumor tissues of patients with metastatic colorectal cancer. So suggesting that the ratio can be used to monitor the progression of colorectal cancer. They also found a significant association between arachidonic acid EPA ratio and the staging of the tumor, but not the histologic grade. So what I have covered so far is the inflammation. What is inflammation? The markers of inflammation, and what are some of the protective fatty acids which are anti-inflammatory, and how this ratio can be used to predict cardiovascular mortality and morbidity, and how these ratios are reversed in chronic inflammation. I'll speak a little bit about, it's a busy slide, so I apologize for it. I'll try to summarize it for you. This is newer research on which is called AGE, Advanced Glycation End Products. Now, what are these AGEs? These AGEs are heterogeneous group of compounds, and they're formed in the body naturally by the non-enzymatic glycation of proteins, lipids, or nucleic acids. And they were first discovered by Camille Maillard in 2019. So they're part of normal metabolism, but when our body accumulates them in excessive levels, they can reach the tissues, they can reach the circulation, and they can become pathogenic. And then they're implicated in the pathogenesis of cardiovascular disease, atherosclerosis, diabetes, obesity, and the complications of those, asthma, Alzheimer's disease, etc. So basically, they cause inflammation and they cause endothelial dysfunction. So think about they're floating in the blood and they're in the blood vessels. They're causing inflammation and endothelial dysfunction. So anything that can result from the endothelial dysfunction can happen because of these ages. And as modern diets getting advanced, that largely they are heat processed, they are more prone to contain high levels of advanced ages. And some of the sources of ages are, as I mentioned earlier, they're naturally formed in the body from non-enzymatic glycation of proteins and lipids, but they are also increased in conditions of oxidative stress and as waste product in metabolism. You can have an exogenous intake, which we see in patients who have poor diet and they are smoking, tobacco smoke. Patients who are elderly and they have impaired renal clearance of these ages and sedentary lifestyle that goes along with weight issues and obesity. So how to decrease these ages in our diet? So steaming is better than cooking products at high heat, especially meat items. And normally carbohydrate-rich foods such as vegetables, fruits, whole grains, and milk contain relatively fewer amount of ages, even after cooking. So they have noticed that these ages are significantly reduced by cooking with moist heat and using shorter time for cooking at lower temperatures, and by use of acidic ingredients such as lemon juice or vinegar that can slow down the production of ages. So if you enjoy grilling, you can use a marinade with citrus or vinegar for a protective effect. So coming to the anti-inflammatory diet. So what is anti-inflammatory diet? So this little table in blue shows SAD, and then there is an AID. So the SAD stands for Standard American Diet, and there's an AID to it, which is anti-inflammatory diet. So typical standard American diet is very high in saturated fatty acids, trans fatty acids, sodium, refined carbohydrates, and ultra-processed food. A totally opposite anti-inflammatory diet is high in monounsaturated and omega-3 polyunsaturated fatty acids, mostly from marine sources, but for vegetarians also from nuts, vegetable and seed fiber, legumes, whole grains, lean protein, and spices, and contains minimal ultra processed food. And we'll talk more about it in my next slides. So it is actually an eating pattern that is that the purpose of that is to reduce chronic inflammation. And if you think about the anti-inflammatory diet, what comes to mind is the Mediterranean diet. The Mediterranean diet is a perfect anti-inflammatory diet. And there's so much research on Mediterranean diet now, which has shown head-to-head comparison with statins to reduce cholesterol. So it's a great diet to have. And any parts of it, or even collectively, it reduces systemic inflammation. And of course, we need to work with individual variability of people as we honor people as unique people or person or body, because they can have a inflammatory condition, or they may have allergies to something which is in the anti-inflammatory diet. So we have to work around it. Also, people may have different effect. Their alcohol tolerance, varies between individuals. So we need to take into account the body weight, the activity level, smoking status, food allergies, all of that when we are working with the anti-inflammatory impact of this diet. So how do we actually measure that somebody is on a diet which has inflammatory effect? So there are few scales which have been used in research. One is called the Healthy Eating Index, HEI, The other is Diet Inflammatory Index, called DII. And third is Empirical Dietary Inflammatory Index, EDI. This is, again, a busy slide. I won't go into the details, but the first slide, Healthy Eating Index, was developed in 2005. And the impact of diet inflammation can be quantified by measuring inflammatory biomarkers that we talked about. In the middle column, the Diet Inflammatory Index, DII, this is a calculation derived from the daily intake of 45 different kinds of dietary factors, which have been found in almost 2,000 studies to modulate systemic inflammatory biomarkers, And these factors include macronutrients, alcohol, fiber, fatty acids, vitamins, minerals, flavonoids, herbs, and spices. But a more clinically pragmatic index is the Empirical Dietary Inflammatory Index, which is based on food groups and was developed in US population using data from the Nurses' Health Study 1 and 2, as well as Health Professionals Follow-Up Study. And it is based on the weekly consumption of 8 pro-inflammatory foods: red meats, processed meats, organ meats, certain fish, eggs, sugar-sweetened beverages, tomatoes, and refined grains. And 8 anti-inflammatory foods: leafy green vegetables, dark yellow vegetables, fruit juice, oily fish, tea, coffee, non-excessive wine and beer. So this EDI has been in most use in most of the research studies. This is the anti-inflammatory diet pyramid, which is proposed by Dr. Andrew Weil, who is the founder of the Arizona Center for Integrative Medicine. I use this pyramid almost every day in my practice with patients. I have handouts printed, and I go over this handout with my patients. And once you start to go over the handout with your patients and even looking at your own diet, I think it will be very informative. It is eye-opener for many patients. And it's also interesting a fact that many people don't enjoy cooking. They don't like to cook. And I see that in my patients when I go over this dietary pyramid. They find it very hard for them to incorporate these things because they're really not cooking. So that is another opportunity for people to engage in cooking and learning about new food, learning about anti-inflammatory food, building a community around food. All of these things matter. So in this anti-inflammatory diet pyramid, you will see that the bottom of the pyramid, the abundance is focused on colorful fruits and vegetables, berries, carrots. So the color, all the colors, think about all the colors, they really come at the bottom, the abundance of that. The next level is complex grains and mostly ancient grains which have not been genetically modified. So we know that our wheat in this country is genetically modified. It is genetically modified to be suited for baking. That's why it has very high gluten content. So I talk to patients about using whole grains and ancient grains, such as spelt, farro, einkorn, and then quinoa, which is very high in protein, which is not a grain, it's a seed, but it's very high in protein. And then beans and legumes. And the pyramid shows you one to two a day. It's very easily Googleable. You can just Google Dr. Weil's anti-inflammatory food pyramid and you will find it. The next one is healthy fats, and healthy fats are coming from all those sources which give monounsaturated and polyunsaturated fatty acid. So nuts and seeds, and then hemp seeds, which is flax seeds and chia seeds. All of these bring the good fats into diet. Avocado oil, and then next comes the meat items, which is mostly fish and cold water fish for people who do use meat. This is another harder thing for patients to do, is to move away or decrease their intake of inflammatory red meat and replace with lean meat and fish. Then the soy food. Soy has received bad name in this country because of the emergence of breast cancer, but it is not the problem of soy. It's the problem of how we have processed soy and how we are selling soy to postmenopausal women for hormonal issues. Soy is a very good protein. It's a whole grain protein, and it has very good qualities. And there's also research showing that it decreases, it improves lipid profile when it's taken a certain amount. Cooking with mushrooms, which are anti-inflammatory. Again, cheeses and eggs are allowed in this diet, but hard cheeses, not softer cheeses. And then really the top two things are about cooking and eating and drinking nicely. So healthy herbs and spices, turmeric, ginger, garlic, and paprika. These are all anti-inflammatory spices. Majority of the Ayurvedic spices have anti-inflammatory and pro-digestive effects. That will be some other session and webinar on Ayurvedic spices. The next is tea. Almost every day I see in my email, there is research coming on either tea or coffee. So many health benefits of tea and coffee, especially green tea, is part of anti-inflammatory diet, 2 to 4 cups a day. And supplements are such as coenzyme Q10, vitamin D, in general multivitamin. It can be customized to patients' needs. And then if people are already drinking, we talk about just having some red wine, not more than 1 to 2 glasses a day. People who do not drink, we never recommend that they start to drink. And then, of course, having a nice, small, medium-sized, dark chocolate, more than 60 to 70% cacao content is great for health, antioxidant, mood elevator. So these are things we talk to patients about. One of the last things that I want to do is to talk about the Dirty Dozen and Clean 15. USDA comes up, researches the agriculture farming practices, and they get this report out every year, which are the Dirty Dozen and Clean 15, which have pesticides or no pesticides. It changes every year. This is the 2023 list. The Clean 15 list, which can be bought non-organic. So any of these vegetables and fruits can be bought non-organic because they have no amounts of pesticides or very low amount of pesticides. Ideally, it should be none. So this is a good thing if you are a practicing clinician to talk to patients, because patients say, I can't buy organic. I can't afford to buy organic. And you can say, you don't have to buy everything organic because there's a pretty good list here that can be bought non-organic. And then the Dirty Dozens, which shows on the right-hand side, is where you need to buy organic so that there are no pesticides. And I always watch for berries every year where berries show up. Sometimes they go into Clean 15, sometimes they get into Dirty Dozens. So looks like in 2023, our berries are going to be, we have to buy them organic. So this is the list here that I also go over with patients about their produce. So to summarize the anti-inflammatory diet, there is a strong evidence that suggests that chronic inflammation is fueled by a variety of lifestyle elements, including diet. And research methods use standardized indices to assess the inflammatory nature of a diet. And understanding the inflammatory impact of diet is derived from the overall composition of diet and not on single nutrients. So it is important to counsel patients on the pattern of their eating instead of focusing on single foods. Thank you. This is the end of my presentation, and I would now like to introduce my colleague, Dr. Shankari Wegman.
Thank you so much, Dr. Prasad, and thank you so much, Dr. Elder, for the introduction. Welcome, everybody. My name is Dr. Shankari Wegman, and I will just start 1 second. So it's an honor to be with you here today. My name is Dr. Shankari Wegman. I'm the Assistant Director for this fellowship program, and I have been a practitioner of Maharishi Ayurveda for over 20 years on faculty at NYU University and for our clinical residential weeks for our master's program. And I've been very grateful to have been mentored by Dr. Manohar, world-renowned by the Ayurvedic physician in pulse diagnosis. My PhD centered in evaluation of an Ayurvedic curriculum for medical education. So this is a real joy to be part of this program that is the first integrative medical fellowship that's specifically designed to have a specialty in Ayurveda for health practitioners. And I'll be sharing the Ayurvedic perspective of our topic today, diet, inflammation, and immunity, and what the concept of diet is from Ayurveda, how imbalance arises, and how then inflammation can arise from that, and ways to maintain immunity. So this concept of Ayurveda, this word Ayurveda in and of itself is made up of two words, Ayu, which means life, and Veda, which means knowledge. So Ayurveda can be understood as that science of life that is really prevention-oriented. It's prevention-based. It's an ancient system of healthcare that is holistic and whole person care-centered. And all the various functions of the physiology, from gross levels of functioning to subtle levels of functioning, can be characterized into three categories known as the three doshas: Vata dosha, that governs all aspects of movement and communication; Pitta dosha, that governs all aspects of metabolism and transformation; and Kapha dosha, that maintains the integrity of the structure. And balance of all the three doshas is an expression of health, and all three doshas have a role in balanced digestion. This understanding of health is, from the Ayurvedic perspective, understood as being established in the self. And proper digestion is a foundational pillar in Ayurveda for health and wellness. So strong digestion is equated with immunity, vitality, enthusiasm, health, energy. And Ayurveda locates weak digestion as the root cause of imbalances such as chronic inflammation. This quote from one of the Ayurvedic texts, Charaka Samhita Chikitstan, describes how fundamental good digestion is for health. Thus, the fire of digestion and metabolism is a root cause of everything. The nourishment and maintenance of the tissues of the body, immunity, strength, complexion, etc., by food depends on digestion and metabolism. In Ayurveda, this understanding of digestion or strong digestion is equated with having a strong Agni or digestive fire. And the sun represents Agni in the universe and the energy of all, it is a source of energy for everything, the source of dynamism for nature, the source of growth. And in the same way, in the individual physiology, the digestive fire or Agni is that source of transformation, including all aspects of digestion and metabolism. And the finest and final product of digestion in Ayurveda is known as ojas, and it has a very important role in maintaining health and immunity. Ojas is the finest and most refined product of digestion and metabolism, and Ayurveda understands ojas as that integrated intelligence of the physiology, the perfect balance of Vata, Pitta, and Kapha doshas. And there's a direct correlation with strong digestion and ojas production. And ojas is responsible for strength, immunity, bliss, longevity, and we can enliven ojas through diet behavior. This quote from Charaka Samhita Sutrastan says that diet and preparations that are conducive to the healthy functioning of the heart and ojas and channels of circulation should be taken. So it's an important aspect of maintaining strong digestion for health and for wellness. Ayurveda offers general guidelines to optimize Agni, to promote ojas production, and to maintain the state of strong immunity. And you can see here on this slide that some general guidelines for diet and digestion from Ayurveda, and I'll just go over a few of them. Ayurveda talks not only about what we should be eating, what we should be favoring or avoiding. So the actual aspect of diet, Ayurveda looks at that, but also Ayurveda talks about when we should be eating and how we should be eating. And all of that impacts our digestion. So I'll just review a few of these guidelines. One of them is to eat in a very quiet and settled atmosphere with a settled mind. So eating without any kind of distractions, without multitasking, without rushing, sitting to eat. This is also important for good digestion so that the digestive system can work efficiently, can work just in helping to reduce any stress, which can also interfere with the digestive process. And in this way, Ayurveda connects the state of mind and the state of body together as also very important for proper digestion. Ayurveda also recommends that the main meal should be at lunchtime, just as the sun is at its zenith at noon, so is the digestive fire or Agni highest at the midday time or at lunchtime. There's more availability to digest any heaviness in the meals. So the main meal is taken at lunchtime, and it's more conducive to proper digestion. Breakfast and dinner can be a little bit lighter in quality and smaller in quantity. Ayurveda also recommends to avoid ice-cold beverages or foods because this can be slightly heavy for digestion. The cold value is kind of the opposite of that digestive fire. So Ayurveda recommends more room temperature or warm beverages or food items, which aid the efficiency and effectiveness of the digestive process. Ayurveda also looks at the importance of how food is prepared. So, for example, these 4 factors also impact the quality of food, which affects the quality of digestion and proper absorption. So food prepared in a pleasant environment is very important by a person who's happy, by a person who's very settled. So that old saying that, food cooked with love tastes better comes to mind. And so the specifics of how food is prepared, how the different foods are combined, along with the state of the mind of the one who's making the food, is also impacting our digestive strength. Food should always be delicious and pleasing to all the senses. All the senses are engaged in digestion. So taking time to appreciate how the food looks, how it's plated, how it smells, as well as all the tastes are important for digestion. And as mentioned before, it's important to favor all warm, well-cooked meals. So really avoiding anything raw or cold, as this can be a little bit heavier for digestion. And it's also important that foods should be fresh and of the best quality. So avoiding any kind of processed foods or leftovers, as also this is heavy for digestion. So all of these different factors and guidelines of how food is prepared, what to eat, when to eat, how to eat, all affect our digestive strength and all affect how we're able to take in the full nourishment from everything that we are eating. Ayurveda also incorporates the knowledge of the taste in helping to balance the doshas and to optimize Agni. So there are 6 tastes from Ayurveda, as you can see here: sweet, sour, salty, pungent, bitter, and astringent. And each of these tastes have a different role in how they strengthen the physiology. And just to give 1 or 2 examples, the sweet taste is very nourishing. It builds the body. The sweet taste is different from, any kind of excess processed sugary food. So it's not that kind of sweet, but it's the sweet that we find in grains, in natural sugars, fruit, etc. And this helps to build the tissues. It helps with rejuvenation, calming the nerves. The sour taste is very helpful for cleansing, so we can see that sour taste in citrus. And Dr. Prasad also mentioned about adding a little bit of citrus, to your foods that can also aid with digestion. The astringent taste is one that can help absorb any water. It has a drying quality, tightens the tissues. We can see this in legumes. And they also have a role, these 6 tastes, in helping maintain the balance of the 3 doshas. So Ayurveda recommends all 6 tastes in each meals, and the tastes also have a specific connection to each of the doshas. They can either pacify them or they can aggravate the doshas. So the diet can be personalized with specific recommendations for foods, herbs, spices for every single individual to help balance their specific conditions. So if our diet is only predominated by a few tastes, if we're only, adding a few tastes to our diet constantly, this could create some imbalance. So having all 6 tastes helps to balance and strengthen the physiology. And this knowledge also helps practitioners to recommend which groups of tastes to favor in their meals to help create balance for digestion. So all of these recommendations that Ayurveda has is to help maintain the strength of the digestive fire. And when digestion is weak, so that digestive fire is weakened, this could lead to the creation of ama. Ama is known as impurities or just that unfulfilled part of digestion, and this can lead to accumulation. If ama starts to accumulate, then this can start to clog the channels of the physiology that prevents nutrients from being delivered efficiently to the cells and preventing waste from being discharged efficiently from the body. And the Ayurvedic concept of ama can also be thought to be of a toxic pro-inflammatory waste product of improper digestion. And when the digestive fire is out of balance, then the doshas are out of balance. And so some signs of ama in the physiology are, for example, indigestion, repeated spitting, constipation, which is that blockage or obstruction. We have, blocked channels, the strength is out of balance, heaviness can be there. This is from Ashtanga Hridayam Sutrastan. So Ayurveda has different procedures for helping to reduce and eliminate ama, to help to eliminate this accumulation of heaviness that can create this obstruction. And so some of the steps in this procedure are one, that we avoid the causative factors. So as Dr. Prasad mentioned, that any kind of ongoing causative factors can lead to a chronic response and something that persists in the physiology. So avoiding the causative factors is one of the most important things. So observing guidelines for proper diet, as we mentioned, proper intake of food, avoiding overeating, eating until the previous meal is digested, having lunch as the main meal, light supper, all of these different aspects of the guidelines of Ayurveda, following them help to avoid this creation of ama. Then we also start to incorporate the use of digestive substances, so specific herbs, specific spices that help to break that ama down. Then we also have different herbal preparations that aid in this process. And then there's a cleansing aspect of cleansing the digestive tract with certain preparations. And then the enhancement of the digestive power. So how we can help that Agni value, it's how to help keep it strong. And this is through a whole series of procedures of having a light diet, a very specific diet with specific grains, vegetables, spices, etc., and having a whole process of shifting our diet slowly, having a little bit more lighter. It's more of a cleanse period that can go for 2 to 5 days according to the individual strength. And in this way, then it prepares the physiology for elimination therapy. So these are effective procedures that help eliminate deep-seated ama, which otherwise could not be removed just by diet alone. And this is a preventative measure that Ayurveda offers that can be applied seasonally to also help remove any accumulated physiological toxins, so they don't carry over from one season to the next season and persist in that way. And this program is administered under the supervision of a trained medical and Ayurvedic physician with appropriate consideration for that specific individual and their digestive strength and capacity. So in all these different ways, all the different Ayurvedic guidelines and recommendations, along with these elimination therapies, Ayurveda really provides so many different ways to help maintain the strength of that digestive power of the individual in terms of what they're eating, how they're eating, when they're eating, etc. All of this that helps maintain Oja's full immunity so that any imbalances are naturally, effortlessly prevented and avoided, and it helps to maintain strength, vitality, and joy in that individual physiology. So this is just a little aspect from the perspective of Ayurveda on how proper diet leads to that value of immunity, that strength of joy and vitality. And so now I'll pass it on to Dr. Elder, who will be talking about some of the scientific research that supports these Ayurvedic recommendations. Dr. Elder.
Thank you, Dr. Wegman. Now, give me a moment, please. So those were two wonderful presentations, and there's, can you see my screen? Okay, is my screen visible? Great. So those are two amazing presentations, and we begin to get a sense for the importance and the complexity of dietary recommendation and diet for health. I'm serving now, I'm very excited and honored to be serving as the executive director of the fellowship. For the past 30 years, my previous gig was as a primary care physician and integrative medicine physician at Kaiser Permanente Northwest. And I found that in my practice with patients clinically, that with diet, there's a range of people, because some people will come into an integrative medicine practitioner and they want a detailed diet plan. They want to know exactly what to eat and when to eat it. Other people can get overwhelmed very easily. And so we need to be prepared with a range of recommendations to meet the patient with where they're at, ranging from the complex to the very simple. At a simple level, tying these ideas together, diet, inflammation, and immunity, as we heard so nicely from Dr. Wegman. If diet is proper and digestion is strong, the natural product, according to Ayurveda, of proper digestion is ojas, which produces bliss and ideal immunity. Good diet, good digestion, good immunity. If, on the other hand, diet is improper, digestion is weak, according to Ayurveda, the byproduct of improper digestion is this heavy toxic substance called ama, which, when accumulating in excess in the physiology, can lead to chronic inflammation. Good digestion, good diet, good immunity, poor digestion, poor diet, chronic inflammation. Now, when I talk to my colleagues and my patients about this, and there's a long list of things, and I can't do all these things. I need something simple to do with my diet. What are some really practical things? Well, one of the main things we'll tell people to do, as highlighted by Dr. Wegman, have your main meal at lunch. Don't eat too much at night. This is something that everybody can understand. And it turns out that clinically, eating too much at night, eating heavily at night, is a main causative factor in ama accumulation, chronic inflammation. And it's an under-recognized cause of a lot of chronic symptoms and chronic illness. Now, this is the Ayurvedic position, and it has been for all those years. It's also borne out by modern science. We know that gut motility is better during the day than at night. We know that insulin levels will rise during the day and then start to taper down in the evening. If you give someone a meal in the daytime, you give the same person the same meal at night, blood sugars will go higher at night. Same person, same meal. If you eat at night, your blood sugar will go higher. Saliva production is higher during the day, and so on and so forth. Under experimental conditions, people, if you take a group of subjects and you expose them to dim light, or if you expose them to bright light, those exposed to bright light will show evidence of improved carbohydrate absorption and gastric electrical activity and motility. There is epidemiologic data showing that people who eat heavily at night have increased risk for heart disease, obesity, and metabolic syndrome. So this all lines up with the traditional recommendation. Now, a second very simple recommendation that we'll make to our patients is to favor warm, cooked foods and beverages and reduce or avoid cold. Warm and cooked is good. Cold, raw, not so good. In fact, we'll tell people who have ama accumulation to buy a thermos, fill it with plain hot water, and sip it throughout the day. Frequent sips of plain hot water heats up the digestive fire, melts away the ama. It's a good low budget detox for just about anyone. And you'll tell people don't drink cold beverages, and they'll kind of look at you like, why not? That's a little weird. Well, as it turns out, there are good reasons for this. The warm beverages, anything cold, anything warm stimulates Agni. Agni is like a fire. Anything cold extinguishes Agni. Now, it turns out that in clinical trials data, post-op abdominal surgery patients given warm beverages versus room temperature show improved first flatus expulsion and gut motility. And similarly, in patients with esophageal achalasia, hot water consumption compared to cold shows results in lower esophageal sphincter relaxation and improved symptomatology. So again, the modern data lining up with the ancient science. And there's even evidence, what we know empirically or from our own experience has been borne out in clinical trial data, that if you take people with upper respiratory symptoms and you give them hot water versus cold water, those drinking hot water have improved symptom resolution. Okay, so those are very simple recommendations that we can make, and then we can layer on the more complex recommendations as the patient is ready. In Ayurveda, we define immunity as the ability to resist imbalance and disease. This ability has as its basis the self-referral functioning of the physiology, which is a state of physiology corresponding to the self-referral state of consciousness, which is promoted by Ojas. So overall health, overall holistic balance of the physiology, body, mind, and spirit optimizes immunity. Now that's a lot of material we've been through, and there's a lot more to learn. And the great way to learn it is to sign up for our fellowship. As mentioned, we'll be admitting our first class for August. It's a 2-year distance learning program, about 1,200 hours. You'll study 10, 12 hours a week. About half the curriculum is Ayurveda. That curriculum is being developed by us at MIU. And about half the curriculum is has been created by our partners at the University of Arizona. They will be contributing the general integrated medicine curriculum. And you'll need to spend about 10, 12 hours a week, but it's on your own time, except that there will be a live webinar with the faculty every 2 weeks and 1 week of on-site training per year at our campus at MIU, Maharishi International University in Iowa. And I want to emphasize, I hope you've gotten a sense for this tonight, that the clinical skills you'll be learning in our fellowship are practical. And you can use them immediately. I hope that you learn some things tonight that you can start using immediately with your patients. Diet, you'll learn herbals, mind-body therapies, 5 sense therapies, pulse diagnosis, exercise. You'll learn evidence-based referral guidelines for acupuncture, chiropractic, and other modalities and systems. So it's a very practical training, drawing on the best of both general integrated medicine and Ayurveda, combining modern science with the ancient tradition and all that clinical experience. You'll learn self-care procedures and approaches so that you can thrive and excel and actually enjoy your practice and learn to optimize the balance between your personal health and your professional life. And as mentioned, our fellowship has been provisionally approved by the American Board of Integrated Medicine. In order to take the fellowship, one needs to be a licensed healthcare practitioner, MDs, DOs, nurse practitioners, physician's assistants, naturopathic physicians, doctors of pharmacy, and dentists. The MDs and the DOs, once completing the fellowship, will be eligible to sit the exam offered by the American Board of Integrated Medicine for certification. Everyone who completes the program will earn an MS degree. Now we're going to open the Zoom here for some questions.
Thank you so much, Dr. Elder, Dr. Prasad, Dr. Wegman. such rich and powerful information that you shared from both integrative medicine perspective and Ayurvedic perspective regarding diet, inflammation with us tonight. So we have several questions. I'm going to go ahead and ask the first one from Dr. Prasad. And the question is, in what ways are the anti-inflammatory diets and the Ayurvedic diets similar? And where do they differ?
Thank you. That's a very good question. So I'll respond by saying they're not anti to each other, anti-inflammatory diet and the Ayurvedic diet. When I think about them, I think that conceptually they are the same. In practical application, they are a little different. So we learned about Ojas and we learned about Ama today. So if you follow an anti-inflammatory diet, you create that Ojas, which is going to be good for your health. And I talked about toxins causing inflammation in the body. And that is the same as Ama, which comes from bad diet. Or inflammatory diet, and you could use anti-inflammatory diet to get rid of that Ama. Now, so these are the similarities. The confusion comes, and it comes for me too all the time, because we promote an anti-inflammatory diet, which is kind of Mediterranean diet, basically. You use a lot of anti-inflammatory spices. And based on your body type or dosha in Ayurveda, sometimes you're not able to use those spices. So if you have high pitta, you would not recommend for those people to be using garlic and onions and or other hot spices. So I did speak about in my presentation that we have to work with individual variability. So I think of this kind of a food allergy, which is not a true food allergy, but they just can't have it because they have this high pitta or particular kind of dosha. So you have to modify the diet, and you have to bring the focus on maybe other parts of anti-inflammatory diet, such as, omega-3 fatty acids, other kind of spices, the teas and coffees, and, the greens. Which is not contraindicated even in Ayurvedic diet, the greens and vegetables and fruits. So so they are similar in concept, practical application may be different.
Thank you. That was a wholesome answer, Dr. Prasad. Dr. Elder, Dr. Wickman, do you want to add to that?
Yeah, that's a great response. A couple of other comments. In theory, the Ayurvedic diet is a lacto-vegetarian diet, which is similar to, but not exactly the same as the Mediterranean diet, which typically includes fish. Now, we don't necessarily push that very hard with patients because not everybody is ready for a vegetarian diet. Now, and then I think there are some different, as Dr. Prasad was mentioning, there are some different stylistic points. I know the Mediterranean diet favors the use of olive oil. In Ayurveda, we use olive oil, but strongly favor the use of ghee as the ideal cooking oil and some things like that. Now, the Ayurvedic diet, some of the foods that we recommend, a lot of, for example, a lot of grains and dals, some of them are not familiar to people in the United States. And a lot of the times, a lot of the foods on the anti-inflammatory diet, the Mediterranean diet, will be more familiar to our patients sometimes.
Thank you, Dr. Elder and Dr. Prasad. I guess it's a really good opportunity for our healthcare professionals to learn how to properly educate in this program their patients. The next question is actually for you, Dr. Elder. They ask, how will fellows be trained to integrate or to choose between the general integrative medicine and Ayurvedic approaches?
That's an interesting question. And I think that Dr. Prasad put it nicely when the diets and the approaches aren't anti. They don't oppose one another. They support one another. And one has to meet the patient where they're at. And a lot of times the patients who come into an integrative medicine clinic have chronic conditions, they're difficult, they may have failed therapy with other practitioners, with specialists, and one needs to have as many tools available as possible to choose from. So the more tools we can choose from to offer and to tailor to the patient, the more likely we are to succeed. So I think that in our fellowship, we're going to be providing our fellows with a richer tool set so that with practice and experience, they'll have a richer set, a richer program of approaches with which to approach each individual patient.
Thank you, Dr. Elder. The next question is for Dr. Wegman. They ask, there are lots of integrative medicine fellowships already available. What makes this new program unique at MIU?
Thank you, Kimia. Yes, so there are about 20 fellowships that we have in the States, and this is the first one really with a specialty in Ayurveda. So as Dr. Elder just mentioned, you know, the general integrative medical portion of this curriculum will be coming from Arizona and integrated with our curriculum with Ayurveda. And it's a really beautiful way to understand how exactly this conversation of how to integrate and how to personalize recommendations for patients. And it offers a variety of new possibilities in recommendations. The first portion of the curriculum will be going over basic principles. So, you know, introductions to mind, body, introduction to lifestyle, to 5 sense therapies, nutrition, diet, botanical. So the study of all the herbs, spices, traditional formulas we'll go deeply into, and then how to integrate that into practice. You know, what is the reality of how to put all of this together? And there's bi-weekly webinars, webinars every other week where you know, we'll go into case studies that can then apply this knowledge of that integration. And the second portion of the program is looking at integrative approaches to the different systems. So integrative approaches to the musculoskeletal system, to the cardiovascular system, to the GI system. So looking at every single system from this lens of integrative medicine and Ayurveda. It'll be very, very special, very unique, and I think very enjoyable for the practitioners to go deeply in this knowledge. And part of it is also, you know, experiencing it for themselves.
Thank you, Dr. Wegman. It's basically the perfect balance of integrative medicine meeting Ayurveda. So thank you for that explanation. The next question is for Dr. Prasad. Why is it helpful to get certified by the American Board of Integrative Medicine, or ABOIM?
Great question. I think I would like to answer it by saying something about ABOIM. So we know about ABIM, American Board of Internal Medicine. American Board of Integrative Medicine was an attempt to certify, to create an image, a very strong public image of integrative medicine in the world. This is one of the organizations which has taken a lot of effort by a lot of people to actually create this board, to legitimize the practice of integrative medicine. And integrative medicine practice includes Ayurveda. It does, because it is the ancient systems of medicine. Integrative medicine is the perfect blend of modern medicine and the ancient systems of medicine. And how can we forget about Ayurveda in that? So this board was created to have legitimacy of integrative medicine practices. And now this board is formed, and this board has the highest number of diplomates as compared to other disciplines in ABOIM that ABOIM supports. Is part of American Board of Physicians Specialties. It's not part of ABIM, but we are graduating as fellowships are coming up. We are seeing, and I serve as the founding board member of American Board of Integrative Medicine. And we see so many people who are trying to get board certification so that they can have a wonderful practice which is recognized by their organization, by patients when they look up, for providers who want to provide holistic care or holistic primary care physician. Patients are looking for who has the qualification. And when they say ABOIM board certification, that really, makes it matter, for them to come to that physician. And secondly, this has not come yet. This is not happening yet, but our goal is that once we have enough providers, MDs and DOs and NDs who, not NDs right now, but MDs and DOs and nurse practitioners who get certified, that the health systems will start to recognize this as a specialty. And one can actually negotiate that you're coming in with a specialty, you're a primary care physician, but you have this as specialty. Because right now it is not recognized as a specialty where you could actually negotiate for a higher pay. Because internal medicine, family medicine doctors are considered primary care physician who are practicing integrative medicine. But once we have this board certification, we are hoping that this is actually recognized as a specialty. So providers can negotiate for a special pay because they are providing a special services. They're filling in the gaps in care of patients that conventional healthcare is unable to provide.
That is huge. Thank you so much, Dr. Prasad. The next question is for Dr. Elder. And the question is, for which types of patients are the diet plans you reviewed appropriate?
Okay, so that's a very interesting question. And I think that any patient who comes in, we should be counseled about their diet. And almost all patients can stand to improve their diet. And which diet we use and how we apply it or what we advise the patient depends on the patient and where the patient is at. So there are some people for whom their diet plan is going to be don't eat so much at night. That's your Ayurvedic diet. Just don't eat so much at night. There are other people to whom we're going to give at the other extreme, someone who's really motivated and has been self-motivated and very involved and self-aware of their diet. We might give them a light Vata diet purification plan, which is a very detailed diet, and for the first several weeks can be very restrictive. Then there are other people who want to improve their diet, but and are ready to do more than just they'll comply. We tell them, you have your main meal and lunch, and we'll do those simple things, but they want to know where to begin as far as what foods to select. And you might start with the anti-inflammatory diet or the Mediterranean diet, which is a diet plan that's going to be a lot more recognizable or easier to begin to incorporate than some of the components of an Ayurvedic diet plan. So it's going to depend on who we're dealing with and where the patient is at. And we want to meet the patient where they're at and take them to the next level of understanding and the next level of improvement.
Thank you, Dr. Elder. And we do have time for just one more question, and that is for you, Dr. Wegman. And the question is, what role do mind, body medicine, and self-care play in the fellowship training?
Yes, thank you. It plays a very important role in the fellowship training. We all know that burnout has affected so many people, and especially for physicians. Even before COVID-19, there was a Medscape survey that reported that over 79% of physicians were reporting burnout. And so that was just even before, let alone after everything that healthcare professionals were going through during the pandemic. And that burnout is also very visible to patients. There's another study from the Physician Foundation that reported that physician burnout was very visible. About 80% of patients were reporting that they could see that impact. So the practice of whole person care is really so important, not only for physician self-care, but also optimal patient care. So part of our program is meditation for the physician, yoga practice, breath work. And in our residential clinical weeks, we'll have extended periods to go more deeply into this. So a lot of rest, a lot of rejuvenation for physicians, a lot of connection to the self. And in that way, growing a community of physicians coming together in this very intentional way of going very deep into the knowledge of how to really deliver the very best for their patients.
Thank you, Dr. Wegman. It really seems like this program, I mean, everyone has worked so hard to build this program specifically for healthcare professionals in mind, to make sure everyone can benefit from it. They can make time to attend it based on the live webinars. It's a hybrid online and in person. And I think everyone is already, who has signed up is excited to come in for the in-person residency to meet everyone and make those connections in person as well. So thank you so much. Everyone, also, please make sure to connect with us on LinkedIn, Facebook, Instagram, YouTube. Our handle is fintmav, FINTM as Mary, AV. And we are probably going to also post this video on YouTube. So make sure to give us a subscribe on that platform and share away the platform with your friends, family, and we appreciate your support. If you have any questions, you can feel free to send those to cim@miu.edu. Thank you so much. And any additional comments, doctors, before we end?
Kimia, did you share the email address if there are any questions that they can email?
Yes, so that's again cim@miu.edu. Thank you, Dr. Prasad. I'm sure they wanted me to repeat that again. So we appreciate everyone and have a great rest of your night or wherever you are.
Thank you all.
Thank you all. Thank you all.
Good night.
Good night.